This program is brought to you by Emory University.
First met Dr. Klein as a teacher when I was a medical student on the OBGYN rotation here at Emory. Was immediately impressed by just her presence. You could tell that she had a knowledge base that was just limitless.
Dr. Klein developed maternal-fetal medicine at Grady. Dr. Klein developed maternal-fetal medicine really at Emory University and within the Emory hospital system.
Her impact spread really nationally in the roles that she had as the first female president of the American College of OBGYN, one of the first female chairs of a department, and I think she really helped to make it not just possible, but comfortable and very valid for women to choose medicine as a career, as a lifestyle, as a way to contribute to society, and to do it with excellence and to be proud about it. She has also served on the American Board of OBGYN, and so she is responsible for decisions that board made about what does it take to be a real OBGYN. And so in a sense, she has touched every board certified OBGYN in this country in one way or another. And a lot of those providers have gone into different parts of the world to carry some of our best methods of care into those regions to help improve the health of women in societies where it isn't really even on an agenda anywhere.
Many of the protocols that we use within the state of Georgia, we have a state network where we have key hospitals throughout the state where women who are pregnant and are very ill can be transported. We have a network of neonatal intensive care units throughout the state. Dr. Klein was instrumental in putting that together with her colleagues here at Emory. Dr. Klein developed the program not only to train future maternal-fetal medicine specialists, but to train our residents and our medical students in the care of the high-risk pregnancy. Most important, she truly revolutionized how we approach that patient population.
There was no question that she was an academic, so she loved teaching, but she also, I think, very much felt that there is a whole body of people that are not insured. They would become pregnant and they might go to the public health department, but most likely they would, just show up and deliver. And so she felt very strongly that those women deserved good care as much as anybody that had insurance.
A legacy as a teacher are all of the physicians that she touched. We're talking about thousands. We're talking about those that she touched as a professor here at Emory University School of Medicine, those that she trained as they went through their residency in obstetrics and gynecology, those that she trained in maternal and fetal medicine, and those who were touched by her through lecturing throughout the United States and throughout the world.
I think Dr. Klein's legacy as a teacher is to never stop trying to help create understanding in your students. There may be things that they can read out of a book, and you can test them out of a book, and they may have knowledge. But you have to actually teach them in front of patients, teach them about their patients, and teach them with their patients so that they understand how to take care of patients. And she did that.
Even though she was a physician, she recognized very strongly how important the role of nursing was in getting the patient to be able to have a better outcome. And so she employed a lot of master's prepared nurses to run high-risk clinics so that, that while a physician might see the patient or a nurse midwife might see the patient, it was all the encouragement and the things that had to happen next that she put in the hands of nurses.
She's one of the heroes of women in healthcare. She sort of was able to forge a path that you had to be really brave to forge. And she did it in ways that allowed her to make an impact that was much bigger than the place that she worked at or even the people that she talked to.
Dr. Klein blazed the path for all women. Now we're a field where the majority of us are female. Her legacy as a physician will be that she tried to provide the same care for every pregnant patient in the state of Georgia and tried to provide equivalent care elsewhere in the world.
And so I think she really leaves all of us in this department understanding that the bar is as high as we want to set it, and when you hit it, set another bar, because there's always something else you can do to make it better for a patient, make it better for a population, or make it better for women in general. Her influence really doesn't have a boundary right now.
The preceding program is copyrighted by Emory University.